Healthy, clean food is your best defense against getting sick. Everybody knows this. Real concern over pharma medicine buying global food supply chains, like Kraft, I do believe, is owned by one of the big pharmaceuticals now. I mean, we really should worry about this. You know, we see issues with not clean food leading to some of our most biggest chronic illnesses. Bottom line, if you create a perverse marketplace, you'll end up with predatory behaviors being the ones that succeed and buy out the rest. We're living in that world, at least when it comes to healthcare. So, eminent domain. Eminent domain is a law policy saying your personal benefit will not interfere with the greater good of humanity. Who owns a disease or its cure? The answer is those who are sick or afflicted by it. Any other legal position assumes a predatory market state. It is not justified either by motive or profit to exploit sick people. The motivation for a cure is implicit within those who suffer. They want to be better. They want to be well. No one wants to be sick. No one wants to see their family member suffer. If it's your friends and your family or the afflicted, you have an incentive for a cure that's beyond anything a profit motive could create. The project ends when the disease is erased from society globally. It has a beginning and an end. It's not a forever thing. Those cured are best to determine how to distribute the cure to those who still suffer. There is no free market motivation greater, no financial benefit to society at large greater, nor is there a more efficient and focused resource motivator to see the objective is achieved. This is the quickest, cheapest, and most profitable outcome, is to actually take the profits out of the system. So how do we do this? 90% plus of society do not profit from healthcare. We only suffer its costs. We have consensus. Collective bargaining through token exchange and combined resources to effectively neutralize profit and convert it to researching for cures. Chronically ill groups and their intimate supporters can pool profits, which I put in quotes, what used to be profits, to focus on vetted research lines to accelerate developments. We can share open source medical data. We can encrypt it. We can put it in a blockchain. We can stripe it across the distributed cloud system to anonymize it, but still allow it to be data mineable so that the researchers that are developing those cures can have access to daily, real-time, chronic medical data in their huge, chronically ill group that they're working for. I mean, maybe you'll find in some diseases there are 150 unique answers that need to be found to handle it for everybody. It's in this data mining and in this data pooling that we're going to accelerate finding those truths. Accelerated testing and data feedback. If you're doing this, human beings respond extremely well to feedback loops. We're all better photographers because we have digital cameras. We can see what we're doing in seconds. We're all better drivers whenever we see one of those radar speed signs. It actually does a better job than a cop on a corner at controlling our speeding because we respond to feedback loops. If researchers are getting good data back, if data miners are giving them good results back in faster and faster velocity, you will see an acceleration of results. Encryption. We can put levels of encryption to make sure we are HIPAA compliant with the protection of these people. It's their disease, they're motivated. Lots of people have already developed this. We can establish a way of doing this. Group voting, consensus, the directing of collective resource, the ability to govern the direction of your own research towards your own cure, to your own treatment. The ability to pool your legal and political power to, in a sense, establish your sovereignty over your illness and to control the direction of where the money gets spent or who profits or how those profits are diverted or how the above costs is diverted. It's more than a cure. You might very well get into the data mining and finding out that the causes are environmental, toxin, food additives, genetics. So let's seek to eradicate these problems at their source. Why keep creating new chronically ill only to have to cure them if we can get rid of the actual environmental issues that create the illness in the first place? Don't we want a better planet? now we've got global consensus. It's not just the sick, it's those that might get sick. Become a peer-to-peer HMO with smart contracts and token exchange. More than one chronically ill group can share a clinic. When I was a kid, HMOs were new. They weren't for profit, they were collective bargaining tools so that people could afford better health care. God knows what happened. It's not that way anymore. This will get that back. It's outside of markets because it is outside of profit and loss. Continued until cures are met. Those who innovate and accelerate towards these achievements get incentives and rewards for outcomes, personally. You know, why wouldn't you, if you were a chronically ill group, reward Jonas Salk for curing polio? Of course you would. He has no concerns. You know, we'll get him on to the next thing. So, if we unpack one and we open it up into the social network, we may very well see the Arab Spring of health and medicine. Everybody ultimately falls prey to health and disease. We are all motivated to have the best health care for our own personal health that we can get. Once again, 90% of the population doesn't benefit financially from a for-profit healthcare system, so we're not fans. Innovation needs a motive. Fear of painful suffering and death is the greatest motivator we have. Trumps profit every time. It's almost insane that we throw profit onto healthcare when it had the best innovative motivator built in. Nutrition, the key factor in health. A case for a safer, more organic and sustainable food supply sector as a key to health. I can see in the Arab Spring this being a derivative as we demand a healthier world. Okay, and that brings up the next one, which is there are probably 100,000 industrial chemicals. 1,000 of them have been tested. 80% have found to have been carcinogenic, mutagenic, or toxic. We still haven't tested the other 99,000. We need to grow up. And this may be very well be the driving force to focus the resources to get what we seem to not be able to get otherwise. I mean, there's a lot of money in healthcare. So if we allow chronically ill groups and we give them the tools, this is what will happen. Hundreds of chronic illnesses with more than 1 million sufferers combined into a super consensus to drive and command policy and law shifts, money and power shifts in healthcare for the rest of us, collectively in a peer-to-peer, trustless, consensus-based, smart contract executed, token exchange distributed, not-for-profit way. So, this is just, after I was done writing all that, I threw this together in 20 minutes after having a coffee and smoke break to try to figure out what are the pieces to make this work. Is it really rocket science I'm asking for? And in reality, it's not. This is the piece that we need to do. Okay? We need to be able to protect their data so it can be shared with their researchers and so that they can put it up easily. There's already a token out there, or a dozen, maybe a dozen, but District OX, for example, has an entire marketplace that can handle the collective bargaining already. All the tools are there to create a voting, consensus-based, token-based marketplace of collective bargaining. We can use another token, Aragon, which is already integrated with District OX to establish reputation and identity, to establish the security that we're dealing with the chronically ill and not some exploitative person trying to skew the outcomes. This is just a smart contract. This is you guys talking about it with everybody. Getting it out to each chronically ill group that there is a project team working on this and that we want to help you get there because we get it and we have chronically ill people in our loved ones, friends, and family. Every one of us does. Okay?